Hello, everyone. I'm Andrea Tarr. I'm the program director for SCAN. And today we are having a special edition of Welcome to SCAN. And I just want to say right at the top that this particular edition of SCAN is brought to you courtesy of the New Jersey Department of Health, the Division of Minority and Multicultural Health. Okay, my guest today is Dr. Evan Rubin. He is the medical director of visiting physician services at the VNA Health Group. And I might add that the VNA has always been a spectacular supporter of SCAN. So Dr. Rubin, thanks for being with me.
And thank you for having me.
So this is an unusual circumstance, just that even the way we're doing the Welcome to SCAN show, but really what is the impetus for doing this is obviously we're living in some unusual times with COVID-19, raging in the air, and nothing is normal anymore. And one of the things that's not normal anymore is just going to the doctor. So because SCAN does serve an older population, we've had a lot of people calling us about what is this telehealth? How does it work? How do I do this? So who better than you to really explain to us what's going on here? How does this work? So let's start by, first of all, if you would, tell me about your role as medical director at the VNA.
I have been a physician for visiting physicians, working with visiting physicians for about 10 years now, a little over 10 years. And 5 years ago, we joined with the VNA. We were acquired by the VNA. So we went from, a smaller entity of physicians, physician assistants, and nurse practitioners to joining a much larger group. And for the most part, we've remained, of our core group within the VNA, just exposed to a much greater kind of house and other services that are all under one roof now. So the communication there is wonderful, and there's a lot more support and communication. So 5 years ago, when we joined with the VNA, I became the medical director of visiting physicians. So now my role is both. I still make house calls. I still have physician responsibilities there. And in addition to that, I do some administrative work. I serve on a number of advisory boards and ethics boards, and give kind of the physician and medicine kind of voice to some of the financial and business people that are there, and also the patient voice as well. I advocate for kind of the patient interactions as well.
Okay. All right, very good. I think there will be some people surprised to know that there are visiting physicians, but there are. So let's talk specifically about telehealth. And first, can you define it for people who might not really understand what does it even mean?
Well, telehealth has kind of a very wide kind of berth of understanding and of meaning. It could be as simple as a phone call and reaching out. Really, anything that uses some sort of technology to make a connection other than an in-person visit.
Okay.
With that could be, you could expand the definition to include that. Typically, it's some sort of video communication, a video conferencing, whether it's something like FaceTime or Skype that some people have on their computers or their smartphones, or something a little more advanced, like there are a lot of platforms now that have been developed or have been around really for probably more than 10 years have been around, but now, of course, it's ramping up a lot of that communication because of the some of the limitations and some of the obstacles that we're facing. So you can have a much more advanced kind of platform, and medically speaking, there are even some things they're devices, home personal devices that can be placed on the body that can help relay information and collect some data. That can be included in that kind of telemedicine definition.
How long has it been around in general use, this whole idea of telemedicine?
Oh, it's been around for a while, more than 10 years. It's that, certainly for us recently, it's been a much greater kind of demand and the need to really rely on it for a lot of the work and a lot of support that we do to help the health and safety of our patients.
And we are going to actually we're going to speak with Jeff Summer, and he's going to talk about some of the technical aspects of telehealth. So we won't even go there. But
Good.
that's okay. Jeff is going to talk about that. But again, our purpose here is to educate people. There's a lot of mystery behind this and some apprehension about, well, how am I going to see my doctor? So first of all, how do you set up an appointment with telehealth? How is this done?
Well, so the first thing I want to say is and that is a totally natural kind of response, a little bit of fear, a little bit of questioning, of uncertainty, and both for the patient and for the physician as well. I mean, when we saw that this was going to be something that was a need that we had to rely on, the explanation, the assurances that I would give to my staff, to the other clinicians and physicians, was extensive. I had to say, this, don't worry. A lot of the majority of the work that's done, even with the televisit, is something that we're all used to doing. It's all about connection. It's all about communication. Luckily, we are still going out and making house calls where it's appropriate and where it's possible. That's still the core of what we do. And that also is about communication. It's about making a connection and making people feel comfortable. So and I try to relay that to the patients as well. Say, this is really, don't think of this as a completely separate entity, as something's totally new. It's still a conversation. It's still a communication and an embrace and a support between two people, really. And that's so that link, that connection is still there, even though it's through a screen, or it should be there. That's the attempt that we try to make. So how it's done is really the same way that we schedule visits when we make in-person visits. The call comes into the office. One difference is there's a little triage that goes on. One, are they capable, right? Do they have the technology to, you need at the minimum a smartphone, something that has an internet connection and a camera, that we can send the invitation, and then there, like we talked about before, there are a number of different platforms.
Yes.
To do this. We have, and we're still in the process of finding the simplest, the most stable, and the most kind of effective and comprehensive as we can get platform to do this. So what we have really selected for is something that's as simple as a text message that comes into the patient and a one-touch click that says accept.
And then you're together on the screen.
Right, and then it erupts on the screen, right? And then the visit begins, right? And it's and then you fall into a lot of similarity with what a regular visit would be. There's an introduction. I often, will express appreciation and gratitude that they were willing and they were, invited me in to be able to do this. Of course, we get consent to be able to communicate this way. And then it unfolds the way, is for the most part, as much as possible, the way a regular visit would go. There's a history, and taking the history is really not that much different than being.
Well, at this point, you're just talking. You're just speaking
right.
as you would be if you were in the office.
Exactly. And one thing for our population of patients that is interesting is a lot of times it's a caregiver that does most of the communication. A family member or another an aide or some other caregiver
who's with the patient, but part of the. Okay.
Exactly. Who's with the patient. So a lot of times, and of course, then a lot of times it's their phone or computer that it's gone to. And, people like to communicate. They like to talk, especially these days when a lot of us have been inside and have a very small group of people that we've communicated with. So I have to sometimes remind them that it's, that I'd like to see and talk to the patient if that's possible too. So
Yes, yes.
again, it pulls in to a lot of what a normal visit would be. Oftentimes it's a family member or a caregiver that greets me at the door when I make a house call. We don't just stand in the entranceway and have the visit and the exam, right? We walk into the room where the patient is. Same thing. You just remind somebody, let's go into the
Mhm.
room. Let me tilt the phone or the camera a certain way so I can see the face, and then if there's something, and then the visit kind of unfolds.
So as the visit is unfolding, how are you managing with things like the patient's vital signs, for example?
Okay. Well, that's a very good question. So that's one of the limitations, right?
Yeah,
To making these visits. It can't be as comprehensive. There's a lot of things we can do. So a surprising amount that we can actually do just through a video communication. Vital signs, getting a blood pressure, getting a pulse and an oxygen, um, are things that I can't do. Now, some patients have digital monitors
right. Okay.
in the home, right? There are some patients that have breathing machines at
Yeah.
home, but there are some people that have blood pressure cuffs and finger pulse oximeters. So we can ask them to put that on,
Oh, all right. Okay.
and if I can see the reading, see, the tricky thing is you have to know what is being done. So I can't take the word of someone who's doing it as a vital sign. I can certainly document it, but then it has to be through that. But some of those digital readouts that I can see and make sure that things are on correctly. What's funny is that even in the home, if someone has a blood pressure cuff with a digital reading, I usually calibrate that to my own manual blood pressure cuff. So you take everything with a little bit of grain of salt when you get, it's not an in-person one-on-one, but a lot of those things you can get are done just as well as if I was in the home.
All right. Now, some issues I'm thinking are best suited to be done, in a phone visit. Obviously, some things you've got to see someone. So what are some examples of for people who want to go to the doctor this type of way with telemedicine? What's best suited for that?
Well, things that, again, an enhanced communication. So things that are easily done this way is if someone needs a medicine refill, they just want to communicate with the doctor,
Yeah, yeah.
this is what's going on. I need a refill now. That could be done with a phone call, and we could just monitor the last time things were refilled also. But some of the things are, for example, wounds and rashes, things like that. If they can angle the camera and I can see the extent of it, what it looks like, how things are developing, the development of granular tissue, or whether there's a discharge or not, have the size of things.
Hmm.
All like skin things can really be done this way. And again, we remember, it's important also to remember why we're doing this right now, right? And that's one of the big reasons is safety.
Yes.
So a visit that otherwise would not have happened can be done this way. And I can, if someone is worried about their respiratory symptoms, coughing, things like that. So I can see, one of the things I can see is someone's effort in breathing,
Yes.
and again, it protects them. If I have 8 visits a day that I'm making, any exposure I've had before seeing them, I want to protect them from that, so I don't make that. But also, if the patient thinks they might be COVID positive, and I want to protect myself, so that's the reason we're doing this. So to be able, any video chat, any conference that way is better than none.
Absolutely. Yeah. Because some
Um,
people are just not going to ever get to the doctor. And this is the only way that you can get to see each other. Yeah.
Exactly. And other things like that you can see the way someone walks, if
Yeah.
I certainly, especially if it's a patient that I know, it's a follow-up, a familiar patient to me, an established patient. And I know that the way they ambulated and how their ease of getting out of bed, of changing positions, using a walker or a cane. And if perhaps there's more struggle, if there's a little bit of a step down of their ability and the function, I can see that too. You can see the fluidity of the gait, or the imbalance. So those are things that I could see through a video chat as well. Now, that said, there was a patient I saw yesterday who had a cough. And, you can see through the video what the cough looked like, but to be able to distinguish a cough that might be pneumonia from a cough that might be allergic and coming from, above, you kind of need to get a stethoscope on that person's chest and listen to see if the lungs are clear. You could argue that a chest x-ray could possibly do that, but and we do have the potential to do those things, but tests are usually more confirmatory. It's getting a visit in, being able to listen to lungs. So that is where the limit to the televisit kind of takes place, or one of the places. And it was helpful.
Sometimes after a visit, I'm thinking you might say to this patient, well, you know what? I've gone as far as I can go, and I am going to have to see you after all.
Exactly. Or the other way too. I've made a visit and I say, all right, I know that things are stable in this way. Let's follow up in 3 days. Let's follow up in a week, but with a televisit, and I can see it, what the improvement has been. And I know this is, we may talk about this later on, but going forward, because this is relatively new to our practice, and then we always ask the question, especially in determining which platform we're going to use, where do we see telehealth fitting into what we do, even when we're back to making visits, right? And that's one of the things that, being able to follow up. Perhaps it wouldn't be realistic to be able to go back and see patients all the time, a full schedule in 2 days, in 3 days, all the time. But touching base with a televisit is a much more practical way of having those touch points, having a much more comprehensive, embracing care. And I think that that's one of the things we're really looking at as something that can enhance the way we practice.
How long is an average or a typical telehealth visit?
Well, I would say typically it's shorter than an in-person visit because of that, because of some of the limitations there. I mean, if you're a friendly, affable person and you can have a conversation for hours with somebody, but with a busy schedule and people to see, it tends to be a little more concise. You can get to the point simply because of it. A lot of times they are more focused visits. There's an acute issue going on, and you can kind of address it in that more focused way and take care of it. The other reason for it being able to, allows for a little bit of a shorter time is because, like I said before, you can have a follow-up. You can have multiple touch points, whereas having a full, traveling geographically to a place, to someone's home, having an in-person visit is a little more comprehensive, a lot more time consuming, not just at the visit, but in getting there and leaving. So that's another kind of benefit to the telemedicine, is being able to have a much greater outreach in terms of geography,
Yes.
And also in terms of the number of touch points you can make with multiple patients.
So as the doctor, what is your expectation of the patient? What do they need to know to get ready for this visit, which is, again, slightly different, but what do they need to do?
Well, again, it's not that different from an in-person visit, for that matter. You want, if medications are a question, if that's one of the issues you want to discuss, having them nearby. Having a list or the bottles nearby that I can read and go over and make sure they match with what I know that they're taking. If we need to change the medicine, I need to know the dosages. If someone's blood pressure is running high or low, and we want to adjust some dosages. Being able to, manage that med list is good. If there is a wound that we want to look at or a rash on the skin, having it easily exposed,
Right.
having a gown or a loose fitting, shirt or something like that, or being in a position where it's easy to look at something like that. Those are things, again, that's kind of typical for even an inpatient visit. And of course, we can back it up my expectation is that they would have a smartphone and have the technical ability to receive the call and connect with telehealth.
But that's all something that would happen when if I go to make my appointment, that would be assessed at that time.
Right. And yes, most of that triage and that kind of determination has happened with the scheduling of the visit. Correct.
So as the doctor, from your viewpoint, are you as satisfied with most of these telehealth visits as you would be during an in-person visit? Satisfied in that you're getting what you need to find out about the patient?
Well, I don't think that, or let me say it the other way. Inpatient visits or in-home visits is always going to be the core of what we do. There's nothing that replaces being in someone's home, physically making that connection. I think that in the current environment, I think that this is a safe way of getting a lot of work done, not all of the work. I see the televisits and this platform, this ability, as more of an enhanced ability to make a phone call, versus a downgraded in-person visit.
Okay.
So I like the accessibility of patients, like I said before, of geographically. There are patients that otherwise live an hour and a half, 2 hours away, and that would take, up the half a day for me to make a visit. And it would take all of that time for one connection, one visit. Whereas this would take, no matter where somebody is, this is a connection I can make, and multiple connections in a much shorter span of time. In some instances, I am satisfied. And like I said before, especially with patients that are established, that I know, I already have a rapport with, I already have a relationship that's been established, then it's great. I really like being able to see them. They like being able to see me. And for the most part, I know what the background is like.
Yeah.
One thing that we're being, that we have to start to embrace is new patient visits with telehealth, where there isn't an established rapport ahead of time. And I'm curious to see what that, relationship is like. And as we saw in setting up for this, this chat, I was describing it to a colleague a couple of days ago. I said, with established patients, when there is a glitch, when there is some technical difficulty, you feel like it's us. We're on the same team, us and the patient, and the technology is, on the other side, and we can laugh at some of the difficulties we're having. When it's a new patient, I'm worried that the new patient will see us and the technology as on the other side, as on the other team. Yeah. And any difficulty there may be put as my responsibility. And that's a natural thing to happen. Mm-hmm. But the truth is, necessity demands, we're reaching out. And like I said before, a televisit is better than no visit. And there's still a connection that can be made when you're looking somebody in the face. And it's all and a lot of it is in the demeanor. It's that embrace. It's the gratitude that you have that try to, when you're making that connection.
So do you feel like this is the future, though? Obviously during this time, we're using this more and more, but this time at some point will end, and will telehealth still continue?
I believe it will. And like I said, I think that the core of what we do, and the value of the in-home, the in-person visits will never go away. There's nothing to replace that. I do think that the use, the utility, and the value of the televisits can be used to greater enhance the scope and the connectivity and the communication, and the comprehensiveness that we can bring to what we do as visiting physicians and with the VNA. I do think it will be here.
I would tend to agree that it doesn't feel 100% normal now, but very shortly, I think it will.
Right.
Right, well, Dr. Rubin, thank you so much for being with me today. I really appreciate your time, and I hope that to our audience, you get a better understanding of this whole concept of telehealth. Remember, if it's important,